Hello, this is Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. Today we're going to talk about a continually controversial subject, and that has to do with long COVID, or as it's now being named, PASC, so post-acute sequelae of COVID. And the reality is, is this even a thing? If it is a thing, is it brand new with COVID that we've never seen before? And if it isn't brand new, or if it is brand new, how common is it? Now, we have to go to the CDC study that was recently published, and I've said multiple times that the CDC has just lost all faith, and it's ridiculous that public health should be trying to manipulate and putting out incorrect data. So in the study, the CDC, the advertisements that the CDC put out, because that's really what they are, the CDC put out 1 in 5 people will develop long COVID. And that's like their essentially brochure. That's the information that the CDC put out. And a lot of people are running with this. And unfortunately, if you open the study, that's not what it's saying. What it's saying is that 1 in 5 people who were sick enough to present for healthcare services developed long COVID. I'm going to go into that in just a minute, but those numbers aren't even close to 1 in 5. If you have 90% of people not presenting to the doctor, that's either they're asymptomatic or the symptoms are mild enough, especially with people testing at home, then that 1 in 5 number is tremendously lower. And yet the CDC is running with that number. In addition, the definition of they called it incidental diagnosis, can't remember exactly what they called it, incident conditions, I think it was. There were 26 possible incident conditions over a list of 26 pages of ICD-10. So it could be from an eye twitch to a thumbnail problem. It was a ridiculous amount of potential diagnosis that fell under this category. So again, just another example of how the CDC has just destroyed what they meant to stand for as the beacon of health and health responsibility across the globe. So how does that compare to a recent study out of the United States Department of Veterans Affairs, huge study involving millions of people, looking at people that were vaccinated and had breakthrough infections, so that was labeled as BTI, and how much they had a risk of developing what they considered long COVID. Now, realistically, they were asking these questions 6 months later, so that's a good time frame. Because if it's been 2 weeks and you're still having shortness of breath and can't run up the stairs, that's not freaking long COVID. That's a normal response to a respiratory viral infection. So a lot of these studies that we're looking at 2 to 4 weeks, that's not it. It's just poor design study looking for the outcome that they want to have rather than really looking for information. So a couple things about the United States Department of Veterans Affairs study. First of all, the average BMI in these studies was 30 to 31, depending upon age group. The average person in here was obese, so you need to let that color your idea of that, because we know how much obesity plays a role in all COVID metrics. So 6 months out, the non-hospitalized groups had 7.8% of them were experiencing long COVID, or post-acute sequelae, PASC, whatever you want to call it. The hospitalized, it was 33%, and the ICU people, that was actually quite high. Well, we would expect that. If you've been in the ICU for a respiratory tract infection, there's going to be a price to be paid. It's going to be challenging to come back from that. Couple interesting things. When they looked at the categories, mental health topped the list by a long shot. I'm going to get into that in a minute. but also next on the list was cardiovascular and then GI. Those three diagnoses encompassed a huge chunk of what people were experiencing. They also compared the BTI, so the people who have been vaccinated, to people who were unvaccinated. And there was a couple percentage points difference, not much. It's certainly not enough to hang our hats on that, we need to vaccinate everybody, otherwise they're going to develop long COVID. It protected, but it was a really pretty small amount. The other thing is that they compared it to influenza. And on average, 8.8% of people develop long symptoms after influenza. So these numbers aren't that much different. Let's get something straight. We have always known that there are a subset of people that develop chronic problems after some type of an infection, usually viral. MS patients, if you talk to them, a lot of them, their symptoms started after some type of viral infection. Chronic fatigue, fibromyalgia, those are all on the list. These are things we have experienced forever. And we don't always have good answers for them, even though you can bet it centers around some degree of autoimmunity. Getting back to the mental health portion, this is not the first time we've seen that mental health is playing a big role in what we call long COVID. There was a study quite a few months ago out of the JAMA Internal Medicine, and they found that the biggest risk factor for long COVID was thinking that you had long COVID. Not even if you had COVID, thinking that you had COVID, not even if you actually had COVID by blood test or antibody or PCR testing, just thinking that you had long COVID put you at increased risk of long COVID. There was another recent study that I'll include in the description that the likelihood of a mental health diagnosis after COVID was quite substantial. Does this come as a big surprise? I would consider some degree of that as a PTSD or a nocebo type response. A nocebo response is where people develop symptoms based on, not because they develop symptoms, because of what they think is going on. So it may be that somebody was asymptomatic, they got a positive COVID test, and all of a sudden they started feeling sick. And the body, you can't deny that that actually happens. It's not new to COVID, it's been around forever, but the nocebo response can be quite strong. And given the absolute media onslaught of how dangerous and damaging and devastating COVID is, we can understand that some people would be terrified with a COVID diagnosis. And that could then kick into something akin to PTSD. We cannot rule this out. It's not saying that these people are making it up. It's not in their heads. But that overlying mental health aspect plays a huge role in potential outcomes. And you can't deny that because we see that in study after study after study. So my personal thought with this is that I've had the people I've talked to and been exposed to, nobody developed long COVID. I have had a handful of patients who had a pretty rough time after COVID. Every single one of them has been doing well or did well and has fully recovered. None of the whole long characteristics, life's destroyed after that. Again, not saying it doesn't happen because it absolutely does. It always has. We also, looking at what I personally think is that we have lung damage that affects the ability to get oxygen into the body. Shouldn't be a big surprise. COVID can be rough on the respiratory system, especially if you have any underlying pre-existing health condition that might aggravate that. I mentioned the PTSD, the nocebo, but a lot of the symptoms that people have as far as neurological, you start depriving the body of oxygen, you're going to run out of breath, you're going to have fatigue, you're going to have brain fog, you're going to have other neurologic problems. A lot of it boils down to healing the lung tissue. Sometimes that takes time. We've had patients do hyperbaric oxygen treatment, and that really seems to help quite substantially. But that feeds back into that idea that largely the people that are having problems that are not mental health and actually physically related problems are lung damage. There's also this concept of using intermittent hypoxia. to retrain the lungs to get more oxygen across them, to get them to function better. And things like HIIT or short burst aerobic activity may be good tools to use here. In this particular study, they actually just cut off oxygen just for brief periods to challenge the body. But it all kind of fits in that same category. And I think the worst thing people can do is just sit on the couch and not do anything. Even though it may be challenging to actually get up and force yourself to do more, even if it's for a short burst. And if that short burst is just getting to the refrigerator, then that needs to be it in a very targeted, challenged way. So as always, I'll post a link to these particular studies. There's a couple of them that I mentioned in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.